In my perspective, sexual satisfaction is probably the key to women's sexual health. We don't really look in sexual medicine at the concept of frequency or partner satisfaction. What we're really looking at is a woman's perception of how she feels about her sexual life. So in that sense, we would define sexual satisfaction as an individual woman's perception that her sexuality is fulfilling to her. In sexual medicine, female sexuality and treatments and research on sexual function has lagged way behind male sexual function. That's a cultural perspective, and it's also, in terms of research, a physiologic perspective. Unfortunately, physicians, nurse practitioners really are uncomfortable with sexuality and talking about sex with their patients. So one of the goals in my practice is really to just open the door and open the dialogue, asking women about whether or not they have any sexual concerns. Women are dying to be able to talk about their sexuality, but they feel it's the healthcare professional's job to bring it up. They don't know that it's okay to talk about it, and so really, women are sort of left hoping that their healthcare professional will say, "Are there any sexual concerns you'd like to discuss?" For women who have vaginal laxity, most of them will complain about lack of stimulation and therefore difficulty with arousal and sometimes even the ability to reach orgasm. And so for them, although it's certainly not life-threatening, their sexual quality of life has been impaired, and they really want to improve their sexual functioning so that they can get back to what they had before. They're not asking to be better. They're not asking for miracles. They just want what they had before. Right now, I think the Viveve procedure is best suited for premenopausal women who have had vaginal deliveries and who are complaining of vaginal laxity that has resulted in some complaints about sexual function. Because vaginal laxity itself isn't going to be something that needs to be treated unless a woman is distressed by that. And for her, the distress is usually going to be in decreased sexual satisfaction, usually lack of sensation or genital stimulation or difficulty reaching orgasm because of that.